we need to think about is how do we get blood into the heart to begin with. And we originally followed, do you remember, on the back of the heart, we followed the venous blood into the heart with, what's this guy? That's the inferior vena cava. Now, one of the things that we think about is that the heart is resting down here and the inferior vena cava is coming directly from the liver up into the heart. This could be, remember that this round ligament was actually umbilical vein at one time. So it could be already ready to go. You know, Mom does that for us. Mom gives us the ready to go. Right? So it's full of nutrients, packed in, and it's got the oxygen, so we don't actually have to go to the lungs. This whole right side of the heart is all about getting to the lungs. Low pressure system. Okay, anyways, here's the coming in, coming in, coming in. There's a little valve right here. Overlying that valve is going to be the opening for the sinus. Okay? And what's this doing here? Oh, I know what that is. Oh, no. There's a little raise in that in there. Okay. Anyways, the blood has come from the lower half of the body. It's been examined by the liver. Even if it comes directly from Mom, it's already been examined by the liver. Isn't that cute? That's so nice. So now we're inside the right atrium, and we have our blood coming from the sinus on the back of the heart. So even the heart's metabolism is being dealt with here, the metabolite. Also, we have a third way in, 1, 2, 3. I'm noticing numbers here. 1 is right there. Oh, that's what that is. That's a 2. I knew there was a reason for that. You just couldn't see it. That's a 2. By golly. That's the deal. Okay, so Roy Cal. Opening for the coronary, not the pulmonary vein, the coronary sinus. 2. And then we have a 3 here, the inferior vena cava. That's it. Okay. So we have 1, 2, 3. It should be a 3. That's why it looked like a raisinette. I was drawing a 3 there. Okay. I feel like I'm doing a stand-up comedy about a liar or something like that. Anyways, 1, 2, 3. So 1, 2, 3 ways to get in. There's going to be everything from above, which is the chest cavity. It's going to be everything around the chest cavity. It's going to be the upper extremity, the shoulder, the side of the head. Okay? Basically, so both sides of the head are going to, not here, both sides of the head and the shoulders are going to come in through the superior vena cava. And so now we have all the blood, okay, from the various parts of the body. Even the lungs, the tissue of the lungs, had to be fed and the metabolites taken away. So that's this too. Okay, it's not the blood that's going to get oxygenated. Okay, from the lungs. That's later on. So now we have all of this blood that has been metabolized and has metabolites in it. And so now we're in this area. Now in the baby doesn't breathe with lungs. The baby breathes with placenta. Right? So the baby's pretty much ready to pump stuff back out again because it's good to go. And so what's happening with the baby, if I were to actually push my finger through here, if it was patent, it's not. It's this little plastic thing. It's not patent. But I would actually get to this septum right here, and the septum would be open. I would go from the right atrium to the left atrium, right through the septal wall. Okay, a little bit would get down, a little bit would get to the next stage here of the baby. And sometimes the baby breathes a little bit, but of course to no avail. The baby is just breathing amniotic fluid. Okay, so this spot right here, notice that the blood comes over and it bounces off in the adult, but it would have gone through in the baby. So in the adult, this is a closure, and it's called the fossa ovalis.